Good afternoon, Dr. Louis Blevins here. We're at the Endocrine Society Meeting 2025, San Francisco. I'm here with Iacopo Chiodini, who's going to share with us his research about mild autonomous cortisol secretion. Could you please tell us about your paper?
Thank you, Lewis. Thank you for having me here. And these are data coming from a study which was set up in 2013. And in patients with mild autonomous cortisol secretion, these were patients with unilateral adrenal masses who were randomized to treatment with surgery or conservative treatment, optimizing their therapy in terms of antihypertensive drugs and glucose metabolism drugs, directed drugs. And we already published the data about these patients at 6 months. A couple of years ago, and these data are referred to the results at 12 months. And more or less, if you look to the number of patients with blood pressure improvement and glucose metabolism improvement, you see that more or less they have an amelioration in 40% of patients with blood pressure, with hypertension, and in 20% of patients with alterations of glucose metabolism. But I think most importantly, if you look to the combination of the amelioration of blood pressure and glucose metabolism, you can appreciate that 60% of these patients after surgeries did experience an amelioration of this parameter, of the combination of these parameters. While if you leave these patients without a treatment, without a direct treatment for for high cortisol levels, they experienced a reduction, a worsening, of their condition in terms of hypertension and diabetes. But more importantly, I think that we have data on the alteration of coagulation parameters, and again, surgery led to an amelioration of coagulation parameters, and also in some parameters of cardiac structure like left ventricular mass index. So overall, we consider that surgery in patients with MACS, and this is a randomized study, remember, probably is very important in obtaining an important amelioration of glucose metabolism and hypertension, and so probably the guidelines should consider this kind of results in terms of indication for surgery in these patients. Thank you.
Thank you for sharing that with us. I have a couple of questions.
Yeah.
So, do you feel like the conservative management was optimized? Were these physicians who were carefully managing all those different conditions?
You can see, for example, the left ventricular. We are recording?
Yes.
Yes. Sorry. You can see here an indirect answer to your question. For example, the left ventricular mass index not only remains stable in patients not treated with surgery, in patients conservatively treated, but in a way, this kind of parameter tended to ameliorate. So probably
very interesting.
This could be an answer to your question.
Sure, yes. And how do you feel about if patients were entered into a trial where they would have adrenalectomy versus, say, therapy that interrupts cortisol biosynthesis? Do you anticipate the results will be similar or different, still in favor of adrenalectomy?
This is a very, very hard question to be answered too.
Maybe the next study.
Yeah, maybe the next study.
Yeah.
The idea here is that for one side I can say, okay, this patient needed to be treated with substitutive therapy for cortisol failure, obviously, in more than 60-70% of patients. So probably the amelioration of these parameters lasted a little bit more than what you can obtain with other form of therapy, like.
Right.
But on the other side, by surgery, you can obtain the complete resolution of hypercortisolism.
Exactly. Yes.
What it is not true. It's not. I mean, so demonstrated as far as I know, with other kind of treatments like drugs.
What about a drug like a cortisol modulator, mifepristone? Do you feel, because we know that that can improve hypertension and glycemic control?
Yeah.
How do you feel about a drug like that studied against surgery? And
yeah, you know, unfortunately in Italy we have not the possibility to use mifepristone. So I'm talking on the basis of what I know from the literature data. Yeah. I would like to have mifepristone because I think that provided that you have to control potassium levels and maybe in many cases also give spironolactone in order to avoid the effect of cortisol or mineralocorticoid receptor. But I think that this could be a very important drug with very acceptable side effects, in particular in men. Because in Italy, for example, we can use other drugs like metirapone, but it happens to me in 4 cases. We have more than 25 patients treated with metirapone in MACS. In 5 cases, with only 1 tablet, I saw an adrenal insufficiency. Because maybe these patients are older than patients with unilateral masses, for example, and so maybe the use of many drugs, many medications could increase the number of the levels of these drugs in the blood. So I don't know why. So I really would like to have mifepristone to try, but unfortunately I cannot.
I love the results of this study because they basically confirm what I've learned to believe throughout my practice, is that these patients do need treatment of their adrenal disease, one way or another. And it's often difficult to have surgeons agree to that when they see a patient who doesn't look Cushingoid. But where this proves that this is a real disease condition, and this condition called MACS exists and needs attention. I really appreciate your work and sharing that with us today.
Thank you.